Hello and welcome to sqadia.com. My name is Dr. Heather Ali. With sqadia.com, you can enjoy thousands of lectures anywhere and anytime. Today, we are going to talk about another very important, amazing, and interesting topic, that is genitourinary emergencies. We'll talk mainly about acute kidney injuries under this section. In this part, as I said, we'll talk about acute kidney injuries, while in the part 2, we'll talk about some other diseases or some other emergencies that are related to genitourinary system. Let's go to the timeline. We'll touch and go the brief description about the anatomy of the male reproductive system and the female reproductive system. It would just be a simple description of the anatomy of both of them. We'll talk about in detail about the acute kidney injuries and what might be the cause of acute kidney injuries. What are the causes? What is the classification? What is their significance? And what is the most common cause of acute kidney injuries? And what to expect in a patient with acute kidney injury. We'll talk about this history that is beneficial or that can help you as an emergency physician to lead to or narrow down your diagnosis, which lead to acute kidney injuries and genitourinary emergencies, which includes obstructive history, which includes any other medical history or the drug ingestion, if there is any, which can lead to acute kidney injury. Moving on to some physical examination, we'll start off with some important vital signs which can cause to acute kidney injuries. Some other examination findings that are multi-system oriented. We'll talk about the specific examination or findings in abdominal examination patients with acute kidney injuries. Then we'll classify the urinary tract obstruction and the cause of acute kidney injuries according to the bladder and outlet obstruction, especially detection of bladder with outlet obstruction, what might be the cause of a bladder outlet obstruction. We'll talk about the staging of acute kidney injuries in detail. How do you identify what stage of the patient is in of acute kidney injuries? What are the determinants of acute kidney injuries? And what values should be taken under consideration in patients with acute kidney injuries, and how to assess and how to diagnose the patient if this patient is having an acute kidney injury or not. We'll talk about the treatment plan of acute kidney injury, especially patients with distended bladder and symptoms of urinary tract obstruction, and what might be the thing that is helpful in those patients with genitourinary emergencies. Again, another classification will be if bladder is not palpable and patient is able to void. Will be discussed in detail what might be the cause and what investigations are required to differentiate simple or pre-renal or renal diseases, just with simple urine analysis and serum analysis. We'll talk about the treatment plan in patients with bladder not palpable and patient able to void, what might be the cause, especially taking consideration of dehydration. Then we'll talk about in the disposition of the patients, those patients with acute kidney injuries. What should be considered in those patients who you receive in emergency department with acute kidney injuries. So you can enjoy thousands of lectures with sqadia.com, which includes emergency medicine and much more. It includes basic sciences and other medical education and lectures on sqadia.com. You can enjoy your free trial. Start from today. Thank you for watching sqadia.com.